Hi, I'm Dr. Rezaian, a board-certified rheumatologist, and today we're doing a comprehensive breakdown of Orencia, also known as Abatacept. Whether you're a patient, caregiver, or fellow healthcare professional, this is your guide to understanding how this unique medication works. Before we begin, this video is for education and inspiration only. It's not medical advice. Please consult your healthcare provider and verify details with trusted sources before making any decisions. Let's start with what Orencia is. It's an immunomodulatory biologic therapy approved by the FDA in 2005. We use it to treat autoimmune conditions like rheumatoid arthritis, juvenile idiopathic arthritis, and psoriatic arthritis. What sets it apart is its unique mechanism. It doesn't target inflammatory cytokines directly like TNF inhibitors do. Instead, Orencia interferes with T-cell activation by blocking the CD80, CD86, CD28 co-stimulation signal. Without this second signal, T-cells can't fully activate, meaning less immune system overdrive, less inflammation, and less joint damage. Orencia is approved for several conditions. First, for adults with moderate to severe rheumatoid arthritis, either alone or with methotrexate or other DMARDs. Second, for children over age 2 with moderate to severe polyarticular juvenile idiopathic arthritis. And third, for adults with active psoriatic arthritis who haven't had success with other DMARDs or biologic therapies. You can receive Orencia in two forms. One is intravenous infusion, dosed based on your weight at weeks 0, 2, 4, and then every 4 weeks after that. The other is a fixed 125 mg subcutaneous injection once weekly, often preferred for convenience. Now let's talk about how well it works. Clinical trials show it reduces disease activity, improves physical function, and slows down joint damage on X-rays. We especially see strong results in seropositive RA patients, those who test positive for rheumatoid factor or anti-CCP antibodies. While it doesn't act as quickly as TNF inhibitors, its long-term structural protection is well documented. Safety is always a priority. The most common side effects are headache, nasopharyngitis, nausea, and mild injection site reactions. Serious risks include infections like tuberculosis and other opportunistic infections, so TB screening is a must before starting. Hypersensitivity reactions are rare, and there's no significant link to malignancy based on current data. Importantly, Orencia hasn't been associated with demyelinating disease or worsening heart failure. That makes it a safer choice for patients with multiple sclerosis or cardiac comorbidities. Routine monitoring includes CBC, liver function tests, and infection surveillance, all part of keeping treatment both effective and safe. So what are the advantages? 1. A unique mechanism, ideal for patients who've failed TNF inhibitors. 2. Generally well tolerated with fewer systemic side effects. 3. No black box warnings for heart failure or demyelination. And the limitations. It has a slower onset compared to TNF or JAK inhibitors. It's less effective in seronegative RA. It requires regular IV or SC dosing, which may not fit everyone's lifestyle. And like many biologics, the cost can be a barrier without solid insurance coverage. Let's compare it briefly with other classes. TNF inhibitors work faster, but may not be suitable for patients with heart failure. JAK inhibitors are oral and act quickly, but carry higher risks, especially for serious infections and blood clots. Orencia offers a moderate infection risk profile, and it's safer for patients with certain comorbidities. So who is the ideal patient for Orencia? Someone with seropositive RA, especially if they've failed anti-TNF therapy. It's also a strong choice for people with a history of heart failure, multiple sclerosis, or even past malignancy. On the other hand, patients needing fast symptom relief or those with seronegative disease may need to look at other options. In summary, Orencia is a thoughtful and targeted therapy for inflammatory arthritis. It's not for everyone, but for the right patient, it offers durable control, fewer side effects, and long-term joint protection. As always, treatment decisions should be individualized, taking into account disease features, comorbidities, and patient goals. Thanks for watching. I'm Dr. Rezaian, and I appreciate you joining me today. If you found this helpful, give it a like, subscribe for more rheumatology updates, and feel free to share this with others navigating similar decisions.